The next interview is very special to me as I sit down with Dr. Alan McOwan. He was there the day I got my HIV diagnosis almost 13 years ago. Dr. Alan McOwan, welcome, and it's nice to see you again.
Yeah, hello, Karl. It's lovely to see you as well.
I mean, we're talking about 12 years ago, I guess now, or I can't even do the math.
13 years, isn't it?
Yeah, 13 years ago. This might be a silly question because you've been doing this a long time, but do you remember anything of me and our interaction and our meeting?
Well, I guess I was surprised that I did actually recognise your face, actually, because obviously at the time we were diagnosing so many people HIV positive. So we were diagnosing about 60 to 70 people a month. Looking back, really made me realise how much my job has changed and how that interaction is very different. I mean, you tell me, Karl, what's your feeling? You've seen everything change.
Well, yeah, I mean, I've said very publicly about that day of my diagnosis, of coming in and having the rapid test and all of that. And it felt like a red digital countdown clock had started over my head, ticking backwards. Can't quite explain that. And my other and immediate thought was, how could have I done this to my parents? And I think now that I've had time to look at that and analyze it, it's very interesting that all comes from the stigma and the fear and the shame that's associated with HIV. And we have come in 13 years a long, long way. In giving this information, though, does it ever get any easier? Has it gotten any easier with the advances and things like U equals U?
Well, I think so. The message nowadays feels much more, yes, things are different. And yes, if we could change things, we'd choose for you not to have HIV, clearly. But our aim is that you're going to live the life you always wanted to live and do all the things you wanted to do. And we're here to help you do that. And so those messages are very, very positive messages to give somebody, whereas before you were giving people a lot of unsure messages.
What about patient reaction, out of curiosity? With the advent of undetectable equals untransmissible, what's the reaction like from people getting the diagnosis? Have you seen a shift in that? As you said, thank God you're seeing less people being diagnosed.
We've seen these huge falls in new diagnoses, which is just the most wonderful thing for someone who's been around since everybody, before there was triple therapy. It's just wonderful seeing this change and seeing the kind of journey of it. But what we're not seeing here at Dean Street, we diagnose about a quarter of England's HIV. We're not seeing any drops in the very youngest age groups. And so I think I find that personally very difficult when you meet a 19-year-old who, and they're positive and they don't really know much about HIV. They don't know anyone with HIV. They've never heard of U equals U. They've never heard the word antiretroviral or CD4 count. And yeah, I guess it kind of brings out like the kind of paternal bit of you. You kind of want to kind of scoop them up a bit and go, oh, let's try and make this all better. But it just also makes you a bit angry because it also makes you think, this is completely unnecessary. We've got all these tools, and yet why is this still happening?
Yeah, and I think, obviously stigma plays a large part in that. As the world has, been gripped by this pandemic and we have all gotten very used to doing everything from our homes, how has that, tell me about the obstacles that has caused as far as Dean Street Clinic and being able to get PrEP out to people?
We were really concerned that people wouldn't be able to access PrEP. And it was all very well to say, well, you're meant to stay 2 meters apart. The reality is not everyone would do that. We did all we could to try and keep people on it. I mean, I'm sure there are people out, and then we obviously were providing online information about if you aren't at risk at the moment, how you can safely stop. But I think now we're kind of getting to the point, I mean, certainly the streets of Soho are definitely starting to wake up. And so I think we're now kind of back. We tried to get people to test during lockdown. But now it's kind of like, how do we now get people to restart their PrEP appropriately? And now it's also like the perfect time for people who haven't used PrEP before to start having taken a period of a break from sex.
How are you guys changing in this day and age? The stigma, I guess, that is associated with STI testing. It's funny, I was talking to some friends the other night, two straight white men in their early 20s, and I nearly fell off my chair when I discovered neither of them had been for an STI or HIV test, and they're both sexually active young men. And I was just shocked by that, and it all came down to the stigma. How's Dean Street helping change the way we look at getting our sexual health treatment and testing?
I guess I'm a great believer. If you don't make people feel like it should be stigmatized, they won't feel stigmatized. If you put loads of signs everywhere saying, please don't feel stigmatized, and smoke out all the windows and talk in hushed tones, you're giving people a message that they should feel stigmatized. I mean, to kind of big you up, Karl, I don't think you can underestimate how important it is for someone to say, I'm HIV positive, and kind of, and your point is, so what? Because often the narrative of these things is, oh, they're so brave, or they're so tragic, but actually just saying, no, I'm just a regular guy, and I'm HIV positive, I'm living my life, and I'm still successful, and I'm not ashamed of it, is an incredibly powerful message to give people.